Blog Talk Radio.
Good evening, everyone, and welcome to House Talk. I am your host, Dr. Lauren Pitts, and joining me tonight is my amazing co-host, Regina Williams. Tonight, we conclude our National Breast Cancer Awareness Month series. On House Talk, we want to make a difference, and we want you, our global listening audience, to make a difference too. We want you to join us in spreading the word about breast cancer awareness and prevention, and encourage communities, organizations, families, and individuals to get involved. We also want to hear from you during the show, so please call us live with your comments or questions at 515-605-9744. Again, that's 515-605-9744. Regina.
Yes, I just want to reiterate, if you're listening out there and you have an experience to share, please give us a call. Because, breast cancer is treated in several ways. And so if you've been through it and maybe you could add to some of the discussion. But we know that it depends on the kind of breast cancer and how far it spreads. Some people with breast cancer often get more than one kind of treatment. So choosing the treatment that's right for you may be hard. You definitely have to talk to your doctor about the treatment options available for your type and stage of cancer. Your doctor can explain the risks and benefits of each treatment and their side effects, because a lot of times the side effects are, really, there's a lot of side effects. And how your body reacts to drugs and other treatments also determines, the side effects that you might have. So people get different opinions. They maybe go to see more than one cancer doctor, and that's fine. Getting a second or third opinion may help you choose the treatment that's right for you. So there are several ways to treat cancer. What is the most common treatment for breast cancer, Lauren?
So Regina, let me just first put the disclaimer out there. Neither you nor I are oncologists. However, we are very big on research, and we have done an exorbitant amount of research on this topic through the American Cancer Association, through Susan G. Komen, and different organizations that are very big on reliable information on breast cancer treatment, awareness, prevention, and what have you. So, what I want to say is that the information that we're sharing does come from a reliable source. We want to provoke your thoughts. We want to get that initial, wheel turning out there for folk that maybe have some questions and, excuse me, for whatever reason, don't feel comfortable asking. So I'm hoping that this information that we have pulled from these reliable resources will serve as just sort of a springboard, if you will, to our listening audience that can help them to begin to have the discussions that they need to have around breast cancer. So what we know about the most common treatment for breast cancer is that there are what are called local treatments. And the treatments that are local, meaning they treat the tumor without affecting the rest of the body. What we've learned is that most women with breast cancer will have some type of surgery to remove the tumor. And depending, as Regina said, depending on the type of breast cancer and how advanced it is, you might need other types of treatment as well, either before or after surgery, or sometimes both. So it's really going to come down to the type that you have, but understanding that there are so many contributing factors that are going to go into determining what the best possible treatment is for the person who's been diagnosed with breast cancer. It's not a cookie cutter approach. It is a case by case scenario that a treatment plan, and we'll get more into that in a few minutes, a treatment plan based on the individual specific medical needs as it relates to their diagnosis is going to have to be put in place to make sure that that person is getting the best possible treatment and care that they can. I also want to emphasize the importance, as Regina alluded to, of getting a second opinion and even a third opinion. So oftentimes, you know, let me back up. What I've found is that information changes at times dependent upon geographic location, right? There are doctors out there that may agree or disagree. And when I think about my own situation and the information that was shared with me when the precancerous tumor was found in my breast, that the way that it was explained to me is that each oncologist, they embrace the processes that they embrace, but that doesn't mean that every oncologist is going to tell you the exact same thing. So our professional recommendation, again, even though we're not oncologists, is that there's really no harm, right? There's no harm in getting a second or a third opinion to see if there's comparable information that the oncologist is sharing with you, but also to see where the recommendations that they're giving you may differ. And then you will have the information that you need to discuss with your family or whomever that's going to be involved in helping you to make this care and treatment plan decision with you. You can make a well-informed decision. I can't tell you what not to do. My recommendation is to make the decision based on enough data. Don't make a decision for your treatment and care based on limited information. You want to make sure that you're getting all the information. You want to make sure that you're asking a lot of questions. And if there's something that you don't understand about treatment recommendations that are being given to you, you have a right to ask and to say, well, what does that mean? Well, what does that look like? What is that going to feel like? You really, really, really ask a lot of questions so that you can get as much information as you possibly can to make a well-informed decision. Is there anything you wanted to add, Regina?
Yeah, I just want to, when you said about getting the data and getting more information, I thought about, there are a lot of breast cancer support groups and other navigational programs and organizations and things like that. And, so even with speaking with different doctors and different professionals, it might also be helpful to reach out to, a breast cancer support group, because those individuals there have, most of them, all of them have gone through something. And I know that sometimes it's the survivors of the group, but it's also family members, and they can give you a lot of different information as well. So there's just so much, and especially with this being, Breast Cancer Awareness Month, like on all of the social media outlets, all the TV stations, radio stations, you name it, there's information, there's links, there's numbers, websites are. So people, just get as much information as you can before you, make a decision on what to do.
Yeah. I just want to add, too, that if you've been diagnosed with breast cancer, you're going to have what we call a cancer care team. And that cancer care team will discuss your treatment options with you. And they should be doing that from a comprehensive perspective and making sure that they're giving you as much information as they can. So again, you can make a well-informed decision, because it's important that you think carefully about each of your choices. You want to weigh the benefits of each treatment option against the possible risk and side effects. And don't allow, and I'm not suggesting, disclaimer, not suggesting that anybody would pressure you into a specific type of treatment, but I guess what I'm saying is don't allow yourself to feel pressured into a specific type of treatment, because you have the right, even with the diagnosis, to take the appropriate amount of time, based on your diagnoses, to weigh those benefits of each of the treatment options, and to make sure that you are truly understanding what the possible risks and side effects and benefits of each option that's being presented to you is. So the other thing that I want to add is, due to improved screening and awareness of breast cancer, coupled with advances in therapy, death rates from breast cancer have been continuously declining since 1990. How awesome is that, right? It's like, we know that it's devastating and debilitating, but we are seeing death rates declining, over the past, 20 some year, almost 20 years. So it's important to remember that breast cancer is a highly treatable disease, and that screening for breast cancer often enables the detection of tumors at their earliest stages, i.e., that's what happened to me, right? It was precancerous. So glad that I understood the importance of my annual screening, so they were able to catch it in time. Because imagine if I were one of those individuals that didn't take the importance of screening, seriously, it could have turned out bad. But because I've, as I've shared numerous times on the show, because I've had a previous cancer diagnosis in my youth of a different type of cancer, there's some degree of me being predisposed to cancer that fuels my obedience, my discipline, if you will, in making sure that I'm taking the appropriate preventative and precautionary measures to make sure that I'm staying on top of my health via, the screening. Excuse me. So again, it's important to remember that it's treatable, and that the screening for breast cancer often enables the detection of tumors at the earliest stages, when treatment has the best chance for success. So I just want to sort of touch bases for a couple minutes on, when we take all of this into consideration, people often ask, right, can you be completely cured of breast cancer? And what do we say to that, Regina?
Well, I from what from the information that I have received, and also in speaking with folks, that while you can't necessarily say that you are 100% cured, I think it also depends, again, on what stage that that you're diagnosed. That's why, again, it's very important to get your mammograms annually and your checkups and everything, because the earlier that is caught, the better survival rate. I think the term most folks use is cancer survivors. As there's always testing done. You're always going to have to you're always at risk because of your history of having it. So I don't think that they say that you're total cure, but that you can definitely be disease free, be in what they call disease free survival.
Right.
At the same time, for me, if you don't have the cancer cells and things of that nature, it sounds as if you're cured, but again, you have to. You're always on alert. You always need to make sure that you're eating right, that you're getting your checkups, that you are living and taking care of yourself, because it can come back.
Absolutely, and that's the thing about it. When I think about, as I said on previous shows, my first diagnosis was in November of 1981, and I was under treatment and care for 10 years. Now, how many years ago was that? A lot, right? I doing the math in my head, 30 some years. But because even though it was that many years ago, whenever I go for my annual checkups and things like that, I'm always questioned about that. Matter of fact, I just got a phone call today asking me some exploratory questions about, are you having any problems? Is anything going on? How are you feeling? And I get those types of calls and once a year, right? Just to make sure that nothing has cropped up, nothing has come back, and there's all of my doctors, my entire care team for every part of my body. They stay on top of that, right? They stay on top of that and make sure that there's always some degree of questioning to make sure that if anything at all has changed, that I'm keeping them in the loop about it so that we can do our level best to stay proactive rather than reactive when it comes to my health with regards to being predisposed to cancer.
Absolutely. Absolutely. Every 60 seconds, someone somewhere in the world loses their life to breast cancer.
Wow.
On House Talk, we honor and remember those who demonstrated strength, resilience, and courage during their journey. They inspire us to keep moving forward and focus our efforts on saving lives, and that's why we have these discussions. Breast cancer awareness and prevention is such an important topic, and we want to help you honor those you've lost to cancer, and we want to hear your stories of survival and resilience. So call us live with your comments or questions while you have us for the next 40 minutes or so. 515-605-9744. Again, that number is 515-605-9744. Your doctor will think about a few things before he or she recommends a treatment for you. They being the type of breast cancer you have, the size of your tumor, and how far the cancer is spread in your body. It's called the stage of your disease. If your tumor has things called receptors for HER2, protein, estrogen, and progesterone, or other specific features, okay? Your age, if you've gone through menopause, other health conditions you have, and your personal preferences also play a role in the decision-making process. And so we want to talk a little bit about who exactly treats breast cancer and what are the types of breast cancer treatment. So we talked a little bit about, the surgery and things of that nature, but I've heard breast cancer, I've heard of metastatic breast cancer. And that's, basically when it spreads to different parts of your body. So who would you in your research or your professional knowledge, do you know who treats cancer?
Well, I will tell you that it was my general practitioner that actually had, I went in for my regular checkup for my physical, and okay, Lauren, it's time for your my mammogram. And I went in for my mammogram. He read the results, and when he saw the tumor, he actually sent me to the breast cancer center. Now, some may or may not, right? So, again, it's going to all depend on your doctor. Now, this is what I find interesting, and this is not a slam or anything like that because, we have great oncologists everywhere. So, at the time, my general practitioner was here in New Jersey, and we know there's cancer centers and all types of work being done to address cancer in all parts of New Jersey, right? But he sent me to Delaware. He sent me to Delaware.
In Millville.
Yeah.
There's Yeah, there's Cancer Center in Millville,
Yep.
Cooper and Camden, Atlantic
Yeah.
City. Yes,
Yep.
all
None
over.
of those. He sent me to the breast cancer center at Christiana Care, and that was, like, this is where you're going. And it's funny because, and he didn't say it in a disrespectful or demanding way or whatever, but, he knew that I trusted him. And his recommendation was, I want you to go to the breast cancer center in Christiana. There was a specific oncologist that he wanted me to work with. And I will say, took excellent, excellent care of me. But for anybody else, so just so you know, based on the treatment options that someone may select, you have different types of doctors on your treatment team, right? And that those doctors could include a breast surgeon or surgical oncologist. That's who treated me. And that's the doctor whose surgery is to treat the breast cancer. That was the type of oncologist that worked with me. You also have a radiation oncologist, and that's a doctor who uses radiation to treat cancer. You have a medical oncologist. That's a doctor who uses chemotherapy and other medicines to treat cancer. And then you have a plastic surgeon, who's a doctor who specializes in reconstructing or repairing parts of the body. You might have many other specialists on your treatment team as well, including physician assistants, nurse practitioners, nurses, psychologists, nutritionalists, social workers, and other health professionals. What I want to add to, and I'm wondering if this is the term that I'm about to share, if it's something that people are aware of. Our global listening audience knows that I'm a couple marriage and family therapist, right? But there is a clinician called a medical family therapist. And actually, when I was in my master's program, I had to take medical family therapy coursework because of situations like these. When you consider the stressors that are placed upon families, particularly the person who's been diagnosed, there is this need for additional support. So when we think about the treatment team that's rallying around the patient and around the family, a medical family therapist can be extremely, extremely helpful, because not only are they instrumental in helping the patient through everything that is going on, they are also systemically in a position to work with the family, immediate and extended, to help the family to be able to deal with their anxiety and their grief and all of the emotions that come with finding out that someone that you love and care about has a breast cancer diagnosis. So I just wanted to put that out there. As far as treatment, we touched on the surgery. So we talked about the local treatments, and I just touched on the systemic piece as it relates to working with a medical family therapist. But there's also systemic treatments. And systemic treatments are drugs that are used to treat breast cancer. They're called systemic therapies because they can reach cancer cells almost anywhere in the body. They can be given by mouth or put directly into the bloodstream. And depending on the type of breast cancer, different types of drug treatment might be used, including chemotherapy, hormone therapy, targeted therapy, immunotherapy. Excuse me. And then there's common treatment approaches, and we're going to touch on them in just a minute. Again, and we're going to say this repeatedly throughout the show, it's really important to discuss all of your treatment options, including their goals and possible side effects, with your doctors to help make the decision that best fits your needs. It's also very important to ask questions, and I emphasized that a few minutes ago. Ask questions, ask questions, ask questions. If there's anything that you're not sure about, this is a very scary time. It is a time that can bring with it a tremendous amount of anxiety and frustration and agitation and a wealth of emotions that come into play when your body is already in inner turmoil because it's been invaded by this dreadful disease. So we want you to ask questions, questions to ask your doctor. That's, that additional information is available. We can post that, the link to some frequently asked questions to ask your doctor. You want to really explore the types of treatment and the ins and outs of that, and what is going to be best for you. I'm begging of you to not be afraid. Just do not be afraid to ask the very important questions, because your health is dependent upon that. You want to add anything, Regina, before we keep it moving?
No, I think you've touched on. I mean, your experience with it is, I think, really invaluable at this point. I mean, I really wish another caller with experience with it would call in. But your experience, I think, is really vital at this point. Yeah.
So I wanted to add to, before we sort of take a look at, how things may differ depending on the stage of cancer that someone may have. There are a couple of other things that I wanted to highlight, because there is the option of considering complementary and alternative methods. And I won't say often, but there are times that your doctor hasn't mentioned these other alternative options to you. And these complementary and alternative methods, by design, they're to relieve some symptoms. And these methods can include vitamins, herbs, and special diets, or other methods such as acupuncture or massage, to name a few. Complementary methods refer to treatments that are used along with your regular medical care. Alternative treatments are used instead of a doctor's medical treatment. Although some of these methods might be helpful in relieving symptoms or helping you feel better, many, and we have to emphasize this strongly, many have not been proven to work. Some might even be harmful. So what I'm saying to our listening audience is, please, 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 don't go rogue. This is your life you're talking about here, and it's so very important to make sure that you are getting all of the appropriate information from a medical professional. Don't think for a moment that I'm saying to discount God in this, because I'm certainly not saying that. As you all know, I believe very strongly in prayer. I believe that prayer changes things. I believe that, we are supposed to exercise our faith, but I also believe that God has given us common sense. And I can't tell you how many times throughout the course of my life I've family, friends, and foe that have died waiting for God to heal them, and they didn't go to the doctors. And it's like, where's the wisdom in that? But again, to each his own. People have to make their choices and what they believe is best for them. But what I'm saying is that I don't believe that exercising our faith means that we have to be so spiritually deep that we don't use wisdom. Does that make sense? Does that sound harsh? Because that's not my intention for it to sound harsh.
No, it doesn't sound harsh.
Yeah,
as a matter of fact, a lot of people they combine, traditional medicine with spiritual, with like you say, alternative methods. So no, I don't think you're sounding harsh.
I think that again, it's just so important to talk to the cancer care team about any method that the patient is thinking about using, because they really can help the patient to learn what is known or not known about the method, which can help them to make an informed decision. And here's the thing too, and I'm not going to get off on a tangent, I promise. But this is the thing. that frustrates the heck out of me when it comes to the spiritual component with healing is that folk get so spiritually deep that they forget to use wisdom. And then you have folk that are, well, God said, and this, that, and the third. And I could be wrong, and I may get hate mail for it. But Regina, I've always believed that God is not going to tell somebody else more about me than what he tells me about me. So if somebody is coming to me and saying, girl, where is your faith at? You just need to pray. You listening to what them folk telling you, this, that, and the third. You better get on your knees and pray. And that's fine. But the Holy Spirit is leading me to take my behind to the doctors and to listen to what they say, because guess what? I'm not saying that all doctors' hands are anointed, but some of them are. And here's the thing. When I received my cancer diagnosis in my youth, my parents and my grandparents were told that I may live 6 months. My grandparents did what the Word of God said. They called in the elders of the church, and they laid hands on. I remember it like it was yesterday. I was sitting in my grandmom's lap. We were in the living room, and them folks surrounded me. They went to praying and speaking in tongues and anointed me with oil and everything else. And guess what? They took me back to the doctors to have the surgeries that I had to have, and I had to have 3. I had to have 3 different surgeries, and as I said, be under the treatment and care for 10 years to make sure that there was no recurrence. And guess what? I'm cancer-free today. We don't know how that could have turned out had they just stayed on the faith part and not trusted that God was going to guide the hand of the surgeon and that he was going to kill those cancer cells that were removed from my body. You know what I'm saying? So I don't want folks to think, I'm not discounting faith, because I'm from we're from a Christian family, and folk believe in the power of prayer, and prayer works and it changes things. In that, though, there was an exorbitant amount of wisdom that was tied to that faith. And here I sit, about to be 52 on Saturday, cancer free. Hello.
Yeah.
The faith, look, the faith and the surgeon and the medical treatment were partners. And here I am today, cancer free. So I don't want folk to be so spiritually deep that they die waiting for God to heal them because they didn't go to get the appropriate medical attention. That's all I'm saying. But again, it's their choice. The last thing that I want to add in before we move on. Were you going to say something, Regina?
No, I said absolutely.
Okay. I also, and this is a huge piece too, because again, it is a very, very, very traumatic experience, and it's a very traumatic experience that takes an exorbitant toll on your mind and your body. And I, as a clinician, as a therapist, I want our listening audience to know that help is needed to get through cancer treatment. This is definitely not a journey that you want to take alone. You touched on it earlier that people with cancer need support and information, no matter what stage of the illness they may be in. It is so important to know all your options and to find the additional resources that you need that can help you make informed decision about your care. Whether you're thinking about treatment, getting treatment, or not being treated at all, you can still get supportive care to help with pain and other symptoms, including the psychological trauma that comes with getting this diagnosis. Communicating with your cancer care team is important so you understand your diagnosis and what treatment is recommended and ways to maintain or improve your quality of life. It is so important to know, and Regina, you touched on it, so I'm just going to expound a little bit, that different types of programs and support services really truly can be helpful. You don't have to go through this alone. And those support services and programs can be an important part of your care. It can alleviate some of the stress that's associated with this type of diagnosis. They might include nursing or social worker services, or as I said, a medical family therapist, financial aid, nutritional advice, rehab, spiritual counsel, call in the elders of the church, godly counsel. Don't forsake the godly counsel. But know that there's a wealth of support out there. In fact, the American Cancer Society has programs and services that includes rides to treatment, lodging, and more to help the patient and their family get through the process. And I'll just share that information real quick, the number for that, and I'll post it in the keys. You can call the National Cancer Information Center at 1-800-227-2345 and speak with one of their trained specialists. Again, the National Cancer Information Center is 1-800-227-2345 and speak with one of their trained specialists that can help get you and your family connected to the additional programs and support services that are available to you. So, goodness gracious.
Yeah, you said a mouthful right there. Because I was just going to say, people think about the immediate medical needs and things of that nature. You know, you talk about surgery and therapies and things of that nature, but there are a lot of other things like, you know, you're not driving yourself there. You're certainly not driving yourself back. And then when you are going through the side effects, you might need someone there. You might need, you know, a home health aide. You might need, and a lot of times when you link up with the support groups and things of that nature, that they help, they add that to whatever, you know, just, they're not just there to, you know, place where you go and talk about, you know, your experiences, but they form bonds and help each other and do a lot of things that your medical insurance might not cover certain things, but through, you know, the resources that you find in these other programs, they help leverage a lot of those types of things and help a person get through. A person, you know, maybe you weren't working when you found out, so maybe you don't have medical insurance, you know, things of that nature. So there's a lot of different things. Maybe you might end up needing help with your mortgage or your car payment, you know, things of that nature. So there are a lot of different arms and legs that are attached to these services, and so I'm glad you put that number out there. But so that's always important. With any, you know, whenever anyone is going through something, you know, big like that, traumatic like that, you know, people don't think about all of the other things, you know, child care. If you got children and you can't take care of them, or you got to go in the hospital for a week and you're a single parent, you know, linking up with a good support system helps you through all of that. You know, I just keep replaying the conversation I was saying last week when I was having a conversation with my friend, and she was explaining to me how she was told, like she received a phone call from the oncologist, I want to say, was where she went to get the test, and the doctor called her and all of that. And it was basically, you know, she was told information over the phone and basically told she, you know, had X amount of time to live, and basically, you know, call me, make an appointment kind of a thing. No bedside manner, no empathy, no nothing. Nothing, just so her first thing, her sister or someone was there. Someone was there when she got the call, and, you know, she must have been white and pale when she got off the phone, and they were like, well, what's going on? And, you know, so, and right then and there, her support system kicked right into gear. No, you call your doctor, because her doctor is who sent her to that person. So you call your doctor. Your doctor and then her doctor linked her up with another doctor, and they all became a support system and an advocate to her because, she was done wrong. Like, she was mortified.
That's just ugly.
Yeah, just mortified. And then they said, no, I'm not going to talk. The next person was like, I'm not going to talk to you about this over the phone. I need you to come to my office. We need to have a conversation. This is not something that we talk about over the phone. There's plenty of options. So just come in, and from there it went. But her initial notification, that she had this life-threatening disease, came by way of a phone call, a nonchalant kind of, I just want to let you know. And she was mortified. So it's definitely important to know where you can go for help, know what supports are out there, and different and advocacy services for whatever the need might be, So I didn't mean to get on a tangent, but that just goes back to that,
Yeah.
Because we're touching informational purposes. We're touching on a lot of things that people need to know. With regard to the stages and different things of that nature, but, just thought that would be good information and helpful to someone out there.
Wow. So the good news is that breast cancer treatments are getting better all the time, and people have many more options today than ever before. With so many choices, it really is a good idea to learn as much as you can about the ones that can help you the most. No matter which ones you choose, all breast cancer treatments have two main goals. One, to rid the body of as much of the cancer as possible, and two, to prevent the disease from coming back. So when we consider the options, and I'm going to word this a little bit differently than what we had originally said. Let's talk about what the types of breast cancer treatment are, and then we can expound a little bit on what that looks like dependent on the stage that the person might be in. So since I switched it up on you.
You sure did. That's all right.
Look, since I switched it up on you.
You better go back to the treatment then. All right, go ahead.
Right. So what I want to, you're funny. So what I want to speak to first is, somebody in the listening audience or somebody in the listening audience who's dealing with this, or who has a family member, friend, loved one, whatever the case may be. So I want to touch on that looming question of how do I know which breast cancer treatment to choose? Because I'm sure some are thinking, like, you know what, even to this point, 43 minutes in, we've shared a lot of information, right? So This is what we'll tell you. When you're thinking about which cancer treatment to choose, know this. Your doctor will think about a few things before he or she recommends a treatment for you. So the initial onus is on the doctor to take into consideration, what your diagnosis is, where you are in the stage of your diagnosis. And they're going to look at the type of breast cancer you have. They're going to take into consideration the size of your tumor and how far the cancer has spread in your body, that's what we're getting ready to expound on. That's called the stage of your disease. They're also going to take into consideration if your tumor has things called the receptors or the HER2 protein, estrogen, and progesterone, or other specific features that Regina mentioned a few minutes ago. They have to look at whether or not you've been through menopause. Do you have other health conditions that they have to take into consideration? They're also going to look at your personal preferences and know that your personal preferences play a role in the decision-making process. Some people, for example, are totally, absolutely, positively opposed to chemo. They don't want to lose all their hair. They don't want to throw up. They don't want to lose weight. So they have to take into consideration what you as the patient or what your loved one as the patient is willing to do or not do. So when we think about the types of breast cancer treatments that are available, there's a bunch. So just know that there are some treatments that remove or destroy the disease within the breast and nearby tissues, such as lymph nodes. These include surgery to remove the whole breast, called the mastectomy, or to remove just the tumor and tissues around it, called a lumpectomy. That's what I had. Or breast conserving surgery. There are different types of mastectomies and lumpectomies. Radiation therapy, which uses high energy waves to kill cancer cells. Other treatments destroy or control cancer cells all over the body. So, for example, chemotherapy. That's one of the ones that folk are like, I don't want chemo. It's like torture. Chemotherapy uses drugs to kill cancer cells. As these powerful medicines fight the disease, they can also cause side effects, touched on them, nausea, hair loss, early menopause, hot flashes, and fatigue. Like, we need more of that, right? What in the world?
Okay.
You want me to keep going, or you want me to chime? You want to chime?
Oh, on treatment.
Yep.
Or we on stages? Because you.
Well, we didn't go to stages.
Back?
Yeah, because I threw you a curveball.
You working me tonight, Lauren. You. Well, you didn't talk about hormone therapy. You didn't talk about surgery.
No, I didn't.
Talk about radiation.
Yeah.
You didn't talk about hormone.
So you want to touch on hormone therapy or the targeted therapy, and then we can go on into the stages.
Okay. I'm like, girlfriend. So hormone therapy. All right. So hormone therapy is when you so they'll perform the test to make sure that to determine if the receptors that feed on the estrogen or the progesterone are stimulating their growth. If the cancer cells have these receptors, your doctor may recommend hormone therapy such as blockers or inhibitors, and they're drugs. So both types of drugs, they will destroy the cancer by cutting off the supply of the hormone. So, and again, there's those side effects, right? So the most common
the side effects are funky.
Right. The most common hormone therapy drug is tamoxifen, and it blocks the estrogen-shaped openings in the cells, preventing estrogen-fueled cancer from growing. And then there's tamoxifen, and can be taken as a pill on a daily basis up to 5 years after surgery. So hormone therapy is pretty much long-term. Yeah, it's pretty much long-term. And when the breast cancer cells are cut off from the food supply, the tumor begins to starve and die. So, so that's kind of I think that's why they do surgery first, to go in and knock out what they can. And again, it also depends, using the inhibitors and blockers, it depends on your stage of life. So you only use them, the inhibitors are only used in postmenopausal women. Right. Because it's also called anti-hormone treatment. Yeah. So, you can kind of think of it as the opposite of hormone replacement therapy. So it depends. So, like when we were talking, we haven't talked about stages, I think, but it just kind of blends in because not only depending on the stage of cancer, but also your stage of life it will depend on the type of treatment. So do you want to add anything else? We can keep going. We got 11 minutes. Yeah. Oh, what? We got
look, right? We got 11 minutes. We can share the information on the stage. It's crazy. And like I said, we'll do like we always do. We'll post, the information will be with the keys for your key rings, so they'll be able to refer back and listen again.
I didn't know this, but there's also surgery to remove your ovaries. that can be part of treatment. Wow, if you're not, this is if you are before menopause. These are one of the options before menopause. Wow.
Yeah, didn't know that.
I didn't know that.
Look,
yeah,
mine are already gone.
Right. Hormone therapy can reduce the risk of reoccurrence by 50%. So,
wow.
I mean, we talk about, whether it's cured or not cured, but, you can knock your off by 50%,
Wow.
But, so we talk about side effects. So you got sexual dysfunction. Yeah. Vaginal dryness, painful intercourse, things of that nature. I mean, small price to pay for living longer. I'm just saying.
Yeah. Well, look, here's the thing with that. You have those same side effects when you have a hysterectomy for some people. Look, let me just put that disclaimer out there. Some people don't have a problem.
Wow. You were also talking.
I was doing good, right?
I guess you was. You too much.
You take me nowhere.
You were talking to alternative, so there's also nutrition and physical activity.
Yeah.
As added to your, as a form of therapy or added to treatment to assist. So a lot of the teams, as you were talking about, where you're going to have a nutritionist, you'd have a wellness coach, dietitian, things of that nature to, cover all of that. I know a lot of folks do. There's a group called Black Girls Run in Jersey, Jersey, Philly, and Delaware, I think. And a lot of those ladies, have experience with some form of cancer, some other, medical issue, and they are using the running as a part of building a healthier lifestyle. And they're out there every weekend, 4 days in the morning doing marathons. A lot of times it's 3 to 5 miles, but they train and they do marathons and things of that nature, as well as, the healthy eating and things of that. And then there's other different clinical trials that, are out there right now. But, so,
Well, I'm going to add, when we're, just to sort of sum up the treatment options for breast cancer by stage, just the overarching is treatment for stages 1 to 3 breast cancer usually do include surgery and radiation therapy, often with chemo or other drug therapies, either before the neoadjuvant or after adjuvant surgery. Stage 1, these breast cancers are still relatively small and either have not spread to the lymph nodes or have only a tiny area of cancer spread in the sentinel lymph node, the first lymph node to which cancer is likely to spread. Stage 2 is these breast cancers are larger than stage 1 cancers and or have spread to a few nearby lymph nodes. Excuse me, chest cold. Stage 3, these tumors are larger or are growing into nearby tissues, the skin over the breast or the muscle underneath, where they've spread to many nearby lymph nodes. Again, it's going to all come down to making sure you're talking to your doctor. If you're someone who is experiencing recurrent breast cancer, that's when it comes back after primary treatment. Recurrence can be local in the same breast or in the surgery scar, regional, which is in the nearby lymph nodes or in a distant area. Treatment for recurrent breast cancer depends on where the cancer recurs and what treatments you've had before. So again, just emphasizing the importance to our listening audience that it's always going to be on a case-by-case basis. There is no cookie-cutter approach, and what works for me might not necessarily be what's in the best interest for you. So, we know that the treatment information that we've given here tonight, it's a lot, right? But again, we want to emphasize that we did obtain it from the American Cancer Society, and it is not the official policy of the American Cancer Society, and it is not intended as medical advice to replace the expertise and judgment of your cancer care team. Let me say that again. We did get the information from the American Cancer Society. However, the American Cancer Society, it is not their official policy. They are not, this is information purposes only. They are not offering this information as medical advice, nor are Regina and I. We are not oncologists. We are not medical doctors. We wanted to share the valuable information to provoke your thoughts and to encourage you to have these appropriate discussions and to take these preventative measures with your medical doctor. It's not medical advice. It should not, nothing that we've shared here tonight should replace the expertise and judgment of your cancer care team or of your medical professional if you don't have a diagnosis. It is intended to help you and your family make informed decisions. It's intended to encourage you to take preventative measures, to take proactive steps, with working in collaboration with your doctor. Your doctor may have reasons for suggesting a treatment plan different from the general treatment options that we've discussed here tonight. We're encouraging you, don't hesitate to ask him or her questions about your treatment options. So, Regina, as we're closing out, as we do every week, with all the information that we've shared tonight, what are those key points that we want our listeners to take away from tonight's discussion?
First and foremost, you need to prioritize your health by making sure you are getting checked regularly. You must go to the doctor. You must get these tests. It is imperative because the earlier, if anything's going to be caught, the earlier it's caught, the better.
Right.
The earlier it's caught, the more options you have, the better chance you have.
Right.
And always use always use the approach I'm trying to say is the well-rounded approach. So, you want to get more than one opinion. You want to have a full support team, and you want to have as much information as you can. So get informed, be educated. Whatever the diagnosis may be, get educated, the more information so that you can advocate for yourself, ask questions, and don't be afraid.
Yeah.
Don't be afraid.
Don't be afraid. What I want to add is to make sure that you talk to your doctor about all the risks and benefits of each treatment option and how they'll affect your lifestyle. You also want to think about, and we've said it and we'll continue to say it, think about joining a support group. Pardon me. Other people with breast cancer know what you're going through and can give you advice and understanding. They might help you decide on a treatment too. And then the last thing is, we didn't touch on it tonight, but I'm just going to put it out there as a tip, for our listeners to be made aware of, is ask your doctor if you should join a clinical trial. And what that is a research study that tests new treatments before they're available to everyone. This is such important information, and we want everybody to know how important it is to stay on top of this. We know that October is Breast Cancer Awareness and Prevention Month, but every day should be breast cancer awareness and prevention. It is a debilitating disease, and we want a world free of breast cancer, and we can each remain diligent in doing our part to create awareness and to keep ourselves healthy and to do our level best to keep our loved ones healthy too. So, Regina, as always, hon, thank you so much for joining me this month. I love you. I love you. I love you. I could not have done this without you. Your commitment and truly your unfailing encouragement really does mean the world to me. Listeners, thank you for tuning.
I was just saying thank you for having me. I love you too. And thank you, listeners, for being out there.
Yeah. Listeners, thank you for tuning in tonight. And don't forget to join Dr. Maiden and me and our guests from the University of Nevada, Las Vegas, Western Washington University, and the University of Nebraska-Lincoln in our powerful discussion next week on mass incarceration. That's House Talk with Dr. Lauren D. Pitts on mass incarceration next Wednesday, November the 6th at 9 p.m. Again, thank you so much for joining us tonight. Good night, everyone.
Good night.